All right, it's noon, so we're going to go ahead and get started. Thank you all for joining us today. My name is Haven Spanier, and I'm the Director of Student and Young Alumni Engagement at the Alumni Association. We're really excited to be able to put on this career series in partnership with the Career Center. So thank you all for joining us, and a big thanks to our host, Sarah. I'm going to introduce her in a second, but before I do that, I want to remind you guys, if you have any questions throughout today's event, you can type those in the chat feature. So if you're watching this on a laptop, you should have a little chat button at the bottom of your screen. So if you click that, you'll be able to pull up the chat feature and you can type in those questions for Sarah throughout the event. But without further ado, I'd love to introduce to you Sarah. Sarah McClanahan has been the communications manager at Lexington Medical Center in West Columbia, South Carolina for more than 12 years. With more than 6,500 healthcare professionals, 70 physician practices, 5 community medical and urgent care centers, an occupational health center, the largest extended care facility in the Carolinas, and a specialized care center for Alzheimer's, Lexington Medical Center treats nearly 85,000 patients every year. The hospital delivers more than 3,300 babies, more than any other hospital in South Carolina, and performs more than 23,000 surgeries annually. Lexington Medical Center also employs a full-service in-house marketing and communications department, with Sarah leading the charge on internal and external communications, including crisis and executive communications, as well as paid media placements and corporate sponsorships. Sarah graduated with honors from the University of South Carolina with a bachelor's degree in public relations. In addition to her role at Lexington Medical Center, she serves as president of the Carolinas Healthcare Public Relations and Marketing Society, where she has been a board member for the last 4 years. So a big welcome to Sarah. Thank you so much for joining us today.
Thank you so much for having me. I'm excited to be here. So I think we will just go ahead and dive right in. I am really looking forward to sharing with you guys today about Lexington and what we do in our marketing department. So I'll just dive right in. This is an example of some of the work we do. Like it was mentioned before, I oversee our messaging for both our internal and external audiences. Lexington Medical Center is currently affiliated with Duke Health for both our cardiovascular programs and our oncology programs. So we've really utilized that partnership and that affiliation to lend a lot of credibility to our programs when we were first getting them off the ground. It's also been a huge benefit to our patients because we're able to partner with Duke and give them access to, specifically for oncology, to clinical trials from the comfort of their own home, which is a huge thing for a lot of people here in this community. This is the example of some of the work that we've put out for oncology. We really create a human interest perspective for a lot of the work that we do. We really want our patients to tell our story for us. We do not want to talk at people. We want to talk to people. And even in our advertising, it's about a dialogue, and it's about the fact that we are part of this community and that we are by your side. Another core service line here at the hospital is our women's services. As it was mentioned, we deliver more babies than any other hospital in the state of South Carolina. Both of my babies were born at Lexington Medical Center, so I can personally attest to the incredible care you get here. And we recently onboarded another OBGYN group, and that added about 700 births to our overall total a year. So we'll be delivering more than 4,000 babies a year. And with the addition of our new patient care tower, we have 70 beds and a new state-of-the-art labor and delivery and special care nursery with all private rooms for our tiny, tiny patients. Another big component of what we do in this marketing department, not only do we do service line marketing, but we support our hospital's foundation and our community relations department. So we do a lot of philanthropic event support. These are some examples of that work. You can see Coach Martin there. Again, more community work. Women's Night Out this year, we actually just finished. We did not get to do Women's Night Out this year, our breast cancer awareness event. This year we did Women's Night In. So if you're interested in checking that out, we produced a 30, I think it actually came in at like 40 minutes, but we produced a 40-minute television show essentially that we broadcast, that we streamed on a website, womensnightin.com. And on that website, people can make a donation and have a loved one who has either lost their battle with cancer or is currently fighting cancer, and have them added to like a rotating banner, almost like a digital tribute to those people. And I believe to date, they've raised about $35,000, and this event launched on October 1st. So we're super excited about that. Let's see. So outside of the glamorous service line marketing that we get to do and the presence that we get to have in the community, all the fun stuff, we also do a lot of clinical support in this office. So in the marketing department here, we do everything from integrated million-dollar advertising campaigns to letterhead and envelope and logo design and business cards. We are literally a one-stop service shop for every physician, every advanced practice provider, every department. Everything comes through this office. So clinical support, patient education, brochures, like I said, business cards, letterhead, envelope, all come from this office. And we have a staff that's about 20 people. We have our own on-site print shop, so we can do large format printing as well as bulk printing. And then we have in-house graphic design, in-house web and video production, in-house project management coordination, and in-house public relations and social media. So we stay pretty busy making sure that we're meeting all of the needs of this district. Our physician network, we talked on that a little bit as well. So we take a unique approach to our physician practices, providing them with their own customized logo, their own look and feel that families with all of the other hospital materials, but we do want them to feel like their own entity as well and have their own identity, even though they are part of our network. We have about 70 physician practices currently, and about 380 employed physicians that are part of our network. These are some examples of our broadcast and web work. Again, we do a lot of it in-house. We recently relaunched our blog. You'll see that down in the bottom. There's Chadwick Bozeman down there. Lexwell. It's fully responsive, which is great for us. It wasn't before, it was pretty archaic, so we're super excited to have Lexwell. And then our LexMed website, our physician practice website, you can really get a feel for how all of our materials family with each other, and they all have they look like Lexington Medical Center. I think that's one of the benefits too of having an in-house team versus working with an agency. So when you're working with an agency, they're not necessarily as in tune with your brand versus having an in-house agency. So all of us here are acutely aware of the mission and the values of this organization, and we are 100% like bought into that. And so it gives us an acute understanding as to what that messaging needs to be and how it needs to be presented. So that's a little bit of additional benefit that you get from working with in-house. So some of the marketing responsibilities, I've kind of talked on this, but this is a little bit of an overview. Overall brand management and logo usage and implementation. Sponsorship, we handle corporate sponsorship as well as have a place on a sponsorship committee that supports the community. So we're, deeply ingrained in all of those community relations and philanthropic efforts as well. We do all printed materials, we handle media requests, we facilitate all photography and video, web production, social media. We also do all of the media planning and strategy, and all of the buying, all of those negotiations, we place all of that, and we manage the print shop. So I know one of the things that we were going to talk about had to do with COVID and what it's like to work in healthcare marketing in a pre and post COVID environment. So everything that I touched on was really mostly pre-COVID. And then COVID happened in March here at Lexington Medical Center, and our whole world sort of blew up. We had to close a lot of our physician practices. We had to cancel what were considered elective surgeries. But the way that an elective surgery is defined is not necessarily an elective surgery. It's still a surgery that needs to happen. It's just a non-emergent surgery. So it was definitely a struggle, and the updates that we were getting from our physicians and from our administrators were happening every 15, 20, 30 minutes to an hour. And we were constantly communicating with both internal and external audiences and doing everything that we could to assure them that, you know, we had them and that we were with them. And we decided as a marketing team that this was such an important time at our organization that we needed to chronicle it in some way. We also serve as historians for the organization. So we have a team, our photographer and one of our project managers felt safe enough to don PPE and make their way throughout the hospital and through our community medical centers, our extended care facility, and really kind of get an insider perspective. And a lot of this footage has been used locally throughout the state as well as nationally. It was featured on Good Morning America. They came here as featured on MSNBC. They came here and kind of got an inside look. I think this is the commercial that we did. After we got all of this fantastic photography, we really wanted to share it with our community and let them know all of the ways that our employees are with them and see if it'll work.
To the first responders, delivery drivers, grocery store employees, factory workers, healthcare professionals, teachers, anyone making sacrifices to support the needs of our community, we're with you.
So that was the main itineration of that commercial that we did. We did a couple of other versions, and you can find all of them on our hospital's website on lexmed.com. And there's a whole section on that website that's dedicated to all of the photography that we took, as well as the video production that we've done where we shadowed our nurses and really tried to humanize what was going on inside of the hospital, because it is really scary. And it was a way for us to still continue to talk to our patients and not talk at our patients. And knowing that everybody was scared, everybody was confused, and, you know, information was coming from so many different sources. And so the best thing that we could do was to let them know that, you know, we were here for them, and we see them, and we see how they are working so hard to support us. We are now entering into this post-COVID recovery phase of our marketing, where we are slowly starting to talk less about COVID. Really right now it's all about flu. We are gearing up for a very large internal and external flu campaign. Internally, our flu campaign has already started. It started in mid-September when flu shots became available to our employees. And we have a 98% vaccination rate among our employees. And flu shots are not mandatory here. We're one of the only organizations in the state, well, healthcare organizations in the state, that does not make flu shots mandatory. But our organization and the people who work here are firm believers in vaccinations as well. They can also decline if they choose, but many of them don't. So flu is going to be a big thing for us, and then we're working on transitioning into more service line marketing again. So it'll be really interesting to see if we're able to successfully do that, and it'll be interesting to see if we're even going to have the opportunity to do that, barring there not being another surge. So I think that may well cover sort of where we are, and I can open it up to questions if anybody has a question about what we're doing here at Lexington. I'm happy to answer them. So I can talk a little bit more about myself too, if that's helpful. So I graduated from Carolina in 2005. And then I did get my degree in public relations. I minored in business administration. And I, right out of college, got a job doing retail marketing for General Growth Properties, which is now Brookfield Properties. But that ultimately led me to my job here at Lexington because I worked on a couple of sponsorships between Lexington and, at the time, General Growth Properties. We did a women's event, a men's event, a kids event, a baby fair event. And so I really got to forge some relationships here at the hospital. And so when a staff writing position came available, I snatched it, I got it. And that just evolved over my 12-year tenure to currently creating a communications manager position. And I oversee internal and external comm. And I handle a lot of our crisis communications, a lot of our executive communications. I work very closely with our CEO and the chair of our board and crafting messaging for them. And I also am the editor for our monthly employee newsletter and our physician newsletter as well. That's a publication that I work with our chief medical officer on. It's 4 physicians, 5 physicians, and I edit that and oversee that publication as well. So I also write a lot. I get to do, I'm kind of the Jane of all trades in this office. I do a little bit of everything. So Taylor's asking what a typical day looks like for me. So I have a really flexible schedule. The hospital's really great. So I'm a salaried employee and I work 8 to 4:30, Monday to Friday, but I'm perpetually on call, as anyone in communications is, because you never know when a crisis is going to hit. I do a lot of media planning. We onboard physicians all the time. And so every time we onboard, we have to create an advertising plan for those physicians, our marketing plan, because it also includes social media and public relations. So I typically will write a marketing plan when we onboard. That's a big part of my job. I handle and because I do the marketing plan and I do the media planning, I also do all of the media buying as well. So I work with a lot of advertising account executives and work on relationship development. We do like content promotion, like we are constantly brainstorming and coming up with ideas that we can be mutually beneficial to each other. So a great example of that is a partnership that we have with our local NBC affiliate, WIS. It's called Health U. That is a brainchild of myself and the account executive team over there. And it is essentially like an online health university. They utilize our content. It's like an RSS feed from our blog that lives on their website. So it just gives their audience access to our health information. And as part of that, they also leverage us as like their go-to source for health information. So if there is a news story, if there is a COVID story, if there is any other flu, it doesn't really matter. They will come to us and ask us if we have a provider who can speak on that particular topic. So again, it's really a marriage between a local news and a local hospital. Lexington Medical Center is the Midland's only local independent hospital. And it's something that we're really proud of. And we're not just a community hospital. We have, 508 beds, and we have these incredible programs, and we have these incredible physicians and staff. So it's not like it's a county hospital. We're a regional medical center, but we're locally owned and operated, which is fantastic. Let's see what else we got. what was it like when you first heard about COVID moving into the US? You know, we really weren't overly concerned in the beginning when COVID first moved into the US. It wasn't until it started to really pick up in the number of cases that we got a little alarmed. And our first patient actually came in on an airplane and then was diagnosed positive in our ED. The scary part for us was when we got our first patient from our long-term care facility from extended care. That's when things kind of got real for us, and we were concerned about spread because all of those residents are in close proximity with each other. Extended care is 388 beds, so that's a lot of people in in one space. And so we were worried about that. Fortunately, we did contain it, and we did not have an outbreak at our extended care facility, but that's kind of when everything all picked up. And since then, we've had an ebb and flow where we've had up to, I believe the highest number of patients we had was like 75 or so inpatients with COVID. We had to convert our units. We had to move other units around to make room for COVID patients. It's, from an operational standpoint, was definitely a challenge, but our administration and our staff really rose to the occasion. We also never had to furlough or lay off any of our staff throughout the COVID-19 crisis in the peak of it. And even now, we have not lost any human capital throughout the coronavirus pandemic. It's something we're very proud of. So we invest in our employees, and we hold on to them. Let's see. How would I sum up my brand in one sentence and what we offer the community? So our brand is a feeling. That's all it is. It's synonymous with our mission. It's providing quality health services that meet the needs of our community. We talk about it all the time because, again, I've talked about being locally owned and operated in an independent hospital. Our doctors, our nurses, our EVS employees, our nutrition employees, our marketing professionals, we are your friends, we're your neighbors, we're your PTA members, we are your congregation members, like we are your community. And so we're invested in your health, and we're invested in this organization, and we're invested in your kids' health. And that's what Lexington Medical Center means. Lexington Medical Center is community. Do we do any internships? We do internships, but they are very specific. We don't promote them, so really it's just done by emailing our offices. Our email information and contact information for our public relations team and for our marketing department is on the hospital website at lexmed.com. And then we will, I think the most we usually do one maybe once a year, but it really just depends on what they're wanting to study and what they want to do when they get out of college. Planning for future external communications when this situation with COVID-19 is changing daily. I mean, we're just kind of rolling with it. I mean, we're planning to be able to continue to do external service line marketing and not have to focus on COVID and face masking. And if that gets put on hold, it gets put on hold. I mean, at this point, all you can do is be flexible. And that's the greatest lesson that COVID has taught us, even as healthcare marketers especially, that we have to have a certain level of flexibility. We have to be able just to kind of tuck and roll. We've got so many other revenue generating service lines that are important for us to get that messaging out, but you can't be tone deaf. And if we're having a surge in COVID cases and our community is starting to be afraid of that again, then you kind of have to take a step back and really reevaluate. It's one of the reasons why we ended up having essentially a COVID campaign that launched in March and April. If you look back at those photos and those videos, it was more of a way for us to reassure the community. Let's see, Does any of your communications team work virtually? We do not. We are all in the office. We have been in the office since the beginning of the pandemic. We are here every day. We're here Monday through Friday, sometimes on weekends, depending if the situation warrants it, but there has not been a day that we have worked virtually. We are considered as essential employees. So we are here in the throes along with everyone else. Do I ever feel overwhelmed by all of my duties? Challenged, but not necessarily overwhelmed. So between doing media planning, doing writing and editing, I really feel like I'm really lucky that I get to embrace a lot of different sides of myself in my role. I get to do analytics. I get to look at numbers and see how our campaigns are performing, and I get to place that. But I also get to be creative and write headlines and contribute to ad campaigns and concepting. So it's a lot of fun, and I wouldn't trade it for anything. Let's see. How can you learn if health communications is the right career for you? Let's see. I love this brand experience described. Great to know for marketing. It is a feeling. It is a feeling. I would say, if you have an interest in health, and it's a passion of yours, like that's a great start to, but yet you're not clinical. That's a great little segue into saying it. I did not know that I would be as passionate about healthcare marketing as I am when I first got into it. I really just saw it as a growth opportunity. And healthcare marketing, healthcare is something that's not going away. We're always going to need healthcare, and we're always going to need people to tell us about it and to know what's available, what services are available, what technology is available. It's always changing, it's always evolving, it's always striving to do better and be better and have better outcomes. So it's really fascinating. If you're into tech, if you're into health, like those things would be driving forces in whether or not you want to get involved in healthcare communication, because again, it makes it so much easier to get up and go to work every day if it's something that you can be passionate about. And I'm super passionate about this organization. So, I think if you can find something you love, you'll never work a day in your life. And healthcare marketing is that for me. Let's see. Oh, and to learn if it's the right thing for you. Again, kind of know what you want, what you like, and get an internship, or not even an internship. Ask if you can job shadow for a day. Someone asked if we do any internships, and we do, but we also have an open door policy, and we're always happy to have somebody come in and job shadow for a day, and they'll spend about a half an hour or so with our team in each role that we have. So you would spend a half an hour with a project manager, a half an hour with graphics and web, a half an hour with broadcast, a half an hour with comm, and a half an hour with PR, and even graphic design. And you can just kind of get an insight into what each of those roles do and what our day-to-day is. So I would find an opportunity to maybe do job shadow if an internship isn't really on the table. Let's see. I'm mass communications senior. Hi, Sarah. I've been exploring health communications, and I'm curious what your take on pursuing graduate school. Possible health communications or public health is. Would it be beneficial for potential growth in this career? So I am interested in going back and going to grad school myself, but I would be going back for just an MBA. I would not be going back to get an MHA. I think it really just kind of depends. It's not necessary to do this job, and I don't know. I know a few people who have advanced degrees who are in a healthcare communications role, but it's not really that necessary unless you want to move into a more administrative capacity. So I would really just spend some time and figure out what you would want to do before you move forward with either public health or health comm. If it's something that you want to do, it would be what capacity do you want to work in the future. Let's see. Have I worked in marketing or communications outside of healthcare? I did. I worked in retail marketing, and I did some work in nonprofit as well. Let's see. So I think what's different about healthcare marketing versus marketing in any other capacity, healthcare is deeply personal. not only talking about your own health, but everybody has an experience. Everybody knows somebody who's had cancer. They know somebody who has had a stroke or a heart attack or has diabetes or has been deathly ill with influenza, or at this point has had COVID. And they bring their own personal experience into any interaction that you have with them, even if it's just looking at a print ad or hearing a radio spot or seeing a television commercial. They bring that personal experience into that experience. So I think, for healthcare marketing specifically, it's knowing that you're talking to people and that those people have their own experiences that they're bringing into it. And you have to be cognizant of that. You have to be aware of that. You have to be empathetic to that and know how you're talking to them. It's even something as simple as a patient who is pregnant, but perhaps had several miscarriages before that. And yet you're going to talk about your birth success outcomes. You just have to it's all in the way that you deliver it. And I think you have to be aware of that when you're crafting any message when you're in healthcare versus any other marketing specialty. Let's see. I worked for a nonprofit for my practicum and found an interest in health literacy and fighting food insecurity. Those are great. But I also not interested in the research aspect of it. I'm more interested in creating campaigns. Just a thought, not a question. I appreciate your feedback. I think that's great. So a lot of what we do too, like I've mentioned earlier, we work with our community relations department. They create, which is outside of marketing scope, a community health needs assessment, a survey process. But the insight that they glean from that is what helps us develop our marketing campaigns and let us know what we need to be focusing on within Lexington County. And we'll be doing more in Richland County as well. Like we're getting ready to open a new community medical center out in Northeast Columbia. It's going to be 5 stories, I think, and 225,000 square feet. It's actually going to be larger than our hospital was when it originally opened in 1971, which is really kind of cool. We're about to have our 50th anniversary next year, so it's a really exciting time at Lexington. I would tell you that if you've found things in health that you're interested in, really latch on to those things and find a creative way. If you want to focus on campaigns, like know your strengths. For me, like I really like the research. I like knowing the why before I start moving into the how. And I think you kind of have to be able to do that. If you don't understand the why you need to do something, you're not going to effectively be able to do it. So, research is a big part of what we do as marketers. We really need to hone in on that. And as technology continues to evolve in the ways and the opportunities that we have to be able to speak to potential patients, you really do need to focus on some of that too. And it will help you make better campaigns too, to really understand why you need to do what you need to do and who you need to talk to. Let's see. Have I been in the same role at Lexington? I have not. I started as staff writer here at the hospital. And that was, at that point, it was really just doing writing for Intercom, our monthly employee newsletter, and overseeing our physician newsletter, which is now called In Scope. And that was pretty much it. And then it started to get more and more as the hospital grew and as the network grew. When I started here, we had like a dozen physician practices. So in the 10 plus years that I've been here, we now have more than 70 physician practices, and several of them have multiple locations. And so their needs also grew. They needed content, they needed brochures, they needed educational pieces, they needed clinical support pieces. We put together, we started offering open heart surgery here after a 10-year battle to be able to do it. We fought a lot of opposition to be able to provide that service. That created a huge content gap for us. So as those content gaps opened up, I found opportunities to fill them. And my position actually did not exist. It was created for me. And I've been in it now for 5 years. And I love it. And I just continue to find ways to grow. I would also recommend, getting involved with a healthcare marketing group for more information on healthcare marketing. I am president for the Carolinas Healthcare Public Relations and Marketing Society. It's chiprams.org if you're interested in looking at that. You can also reach out to us, and we do a lot of WebEx. We do a lot, well, now we do a lot of WebEx, but we also do an in-person conference every year. It's a great opportunity to network and to really meet some people, and lots of hospitals in North and South Carolina, as well as some outside agencies participate as well, so that are specific to healthcare. Let's see. Do you PubMed for research? What kind of research techniques do you use? We leverage, or are in the process of leveraging, a customer relationship management platform. We also have an integrated electronic health record system, so that helps a lot. And then we rely on some outside agencies to pull research for us. Again, I mentioned that community health needs assessment. That's a big pull for what we do. We also look at our own numbers, our own revenue generators, and figure out where the largest ROI opportunities are for us. And that kind of dictates what we do from a marketing standpoint. Let's see. Can you describe some of your research processes? I work in social media, so I do a lot of listening and looking at popular trends and analytics. My research of choice is surveying and asking questions. At least favorite is scholarly research using PubMed. So a lot of what we do is kind of trial by fire too. So we do a lot of different itinerations when you're talking about like looking at analytics and looking at what's performing and what's resonating and what's not. We do a lot of trial and error. We do campaigns that we'll run like 3 different itinerations of each campaign and see which one patients or potential patients engage with. And that'll be what we go with. So it's really more focus groups. And we'll even do focus groups and pull from existing patient populations and survey them that way as well. So a lot of what we do is more based on public engagement and interest. It's not numbers and crunching, but we also leverage, I mentioned customer relationship management. We look at our Press Ganey surveys. We find out from a patient satisfaction perspective what areas we need to improve in, and then we'll take that information and focus on those service lines. Let's see, what have you found is most successful marketing tool for Lexington Medical Center, social media, commercials, etc.? So that's a really tough one because we do a lot of really good things and we do them really well. Social media is great. It works really well for us. Our primary demographic is women ages 35 to 54. And maybe even skewed a little bit younger depending on the service line for women's services, for example, because we want women of childbearing years as well. So ultimately our goal is to try to get them in from an OB standpoint. Once we get them in as an OB patient, then we can get them in as a family medicine patient and a pediatric patient for their child, and then funnel them through to the other subspecialties that we have here. But we do a lot of broadcasts. We do a lot of video. Video is the most dynamic, and I think the video that we do specifically for social media is probably the most effective tool that we have. I'll talk again briefly about brand and brand being a feeling. Something that Lexington Medical Center does that not a lot of organizations do is every year we do a Christmas commercial. It's like a hug to the community every year. And you can actually go and see these Christmas commercials. I believe the website, the URL is still live, but it's lexmedchristmas.com. We have done 13 of them. They started right before I started here at the hospital. We are beginning production as best we can, as safely as we can, on this year's Christmas commercial. But it's something that we've become really well known for is our video. So I'd say that that's probably the biggest thing, but everything that we put on traditional broadcast, we put on the web and we put on social. So I would say social video is probably our most effective marketing tool right now. Let's see. Best approaches for ROI for your organization. Love those commercials. Thanks. We love making them. The best approach for ROI for our organization is really, you have to sit down and look at it. We partner with our accounting team to really figure out, like, how much from the moment a patient walks into the door, what that patient costs the organization and what that procedure costs. So to really try to figure out how much revenue that we could potentially make off that one patient, then we'll figure out based on that campaign how much that one patient cost us. I think we're really lucky in that we are a healthy and thriving organization. And so there hasn't been too much of a focus on ROI because we are a healthy organization. It's not, and we have the support of our board in this department, that we are not so revenue or ROI centered. It is important, but we again know that just because there's not an action on a campaign during the 6 months of that campaign, it does not mean that 6 months later there won't be an action on that campaign. So we're very cognizant of that, and our board is cognizant of that, and that's good. Do we ever sponsor sporting and cultural events? We do. We sponsor a lot of events. So actually, we sponsor a lot of arts events. We are sponsors for the Columbia City Ballet, the Columbia Classical Ballet. We sponsor Town Theater and Village Square Theater in Lexington and the Harbison Theater. Broadway and Columbia series, we sponsor that. So we're big into arts. We also are big into sports. We, for the longest time, had a partnership with the university and their athletics team, their athletics department. We currently don't do that anymore, but we do a lot with our high schools in both Lexington and Richland counties. We support all of their booster programs and have a presence at their athletic events. So that's a big deal for us. And then we do a lot of other community partnerships. We sponsor community festivals. And let's see, what else do we sponsor? We sponsor, again, going back to Christmas, community, it's a feeling. We sponsor the like a drive-in light show at Saluda Shoals, and we sponsor Carolina Lights at the Lexington Medical Center Fair Park, which is right across from Williams-Brice Stadium. So yeah, we sponsored homecoming before at the school. Like, we try to do as many things as we possibly can. We want the community to know that we're here and we're part of it and we're with them. So these are great questions, guys. Oh, let's see. So good job marketing towards women in your OBGYN. Oh, thanks. Actively looking to include in your marketing strategies to improve on. So the campaigns that we're running right now, so we have a lot of onboarding campaigns that we're running because we're constantly hiring physicians. We are currently running a campaign for a new neurosurgeon here at the hospital. We are running a campaign for a new ENT surgeon who focus specifically on head and neck cancers. We are running campaigns for 2 new OBGYNs who just joined UofSC OBGYN, one of our newest physician practices. And we're also running a campaign that ends at the end of this month that's on the hospital's brain tumor program, which is a super exciting new program here at the hospital. And I think like neurosurgery is super cool. So like that's a really fun campaign to work on. So I think actively, we're going to be pushing oncology. We are getting ready to work on a special section that, in a collaboration with the state newspaper, we'll be producing a hopefully 8-page, but it could very well go to 12-page broadsheet insert in the state newspaper that focuses on a lot of the technology that we have here at Lexington that's specific to oncology. It looks like we're getting ready to install our 3rd linear accelerator here at the hospital, which I think means we'll have more linear accelerators than any other hospital in the Southeast. I'm pretty sure that's accurate. Don't quote me on that, but I think it's right. So oncology is a big one for us. That'll be a big push for us. And then I think ortho is still a big push for us. Brain and spine, musculoskeletal, that's going to be something that we'll look at in the future, going into first quarter of 2021, barring no giant COVID surge. But yeah, those will probably be the 2 that we are going to really look at how we can enhance our audience. We're really fortunate that we're able to provide a lot of supportive services in those two areas, but we're trying to make sure that we're speaking to people when they need that service, and getting them to take that action then, as opposed to, like I mentioned before, even knowing that our campaigns are effective, because we do get some actions, but some of those actions don't happen 6 months down the road. And ortho is a great example of that. And even oncology is a great example of that. You just never know. Does anybody have any other questions?
Right. There were so many great questions today. I do think you got all of them. Yeah. That's great. Thank you guys so much for joining. I hope, oh, it looks like maybe one more question just popped on in.
Sorry, need a Diet Coke. Okay, how important is writing and editing for my job? Very, very important. I have to self-edit a lot. I have to write a lot. So I do, like I said, articles for our internal employee newsletter. I send out and write all of the copy for our LMC Everyone emails. So I populate website content. I wrote radio copy today for a new Connor Shaw orthopedic ad that we're going to run. So I wrote copy today for a radio ad for urgent care. I wrote ad copy yesterday for a new pediatrician we're onboarding in November. But then I'm also, I edited a form about a bunionectomy last week. So I really do run the gamut with this clinical support stuff and then the fun creative stuff. So writing and editing is super important. I think I have right here my Associated Press style book. It is with me all the time. And I even created this little sucker right here. These are the logo and brand guidelines, a style book that's exclusive to Lexington Medical Center. So it's really, really important to be able to write and edit yourself, and be able to be an effective communicator. You have to be able to write and you have to be able to edit in order to effectively communicate. Let's see, as a visual communicator, you need to improve on this skill set. Yes, and as a writer and editor, I probably should improve on my visual communication skill sets. I mean, I know what I want it to look like, but I can't make it look like anything. That's why we have graphic designers, and they're incredible. How you can improve on your writing? Practice does make perfect. That's right, perfect. Yeah, and write over and over again, and write for fun. You don't have to write technical. You don't just write, put down your thoughts. Journaling is great. You don't have to, the practice is perfect. And by practice, I mean, just do it. Just write a lot. It doesn't have to be perfect. You can go back and edit, and you can re-edit, and you can revise, and you can do it again. What's important is that you're actually writing. And writing scientific information is to me. Yeah, when I got my job, I had to take a spelling test and a grammar test. So it's really important to be able to spell anesthesiology if you're going to work in healthcare. So make sure that you hone in on some of that scientific and medical terminology. But there's also Google, so don't be afraid.
All right, well, thank you so much, Sarah, for answering all these fantastic questions and for giving us that great presentation on all your branding guidelines and things. I hope this was helpful for everyone who joined in today, and thank you all for joining. If you're interested in any of our other virtual events, we have them all up on our events page, UofSCalumni.org/events. We'd love to see you back for more. And just again, thank you so much, Sarah. It was fantastic.
Y'all are welcome. Happy to do it. Go Cox.